Hi, my name is Ashleigh Andrews. Today I'll be discussing the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, HR 2530. This bill addresses a critical issue in our healthcare system, unsafe nurse staffing. I'll walk through why the bill is needed, the evidence behind it, and policy recommendations for its improvement and implementation. Across the country, hospitals are operating with dangerously low nurse staffing levels. While this has been an issue for decades, the COVID-19 pandemic turned it into a full-blown crisis. Nurses have experienced chronic understaffing, moral distress, and increasing levels of burnout. This has resulted in nurses seeking to leave the bedside, with experienced nurses retiring early and younger nurses seeking roles outside of direct patient care. This not only weakens the workforce, but also directly impacts patient outcomes. Unsafe staffing affects care quality. Nurses are forced to choose between competing demands, often unable to spend the time needed to deliver safe and thorough care. These working conditions are unsustainable. HR 2530, the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, was introduced in response to this crisis. It provides a legislative framework to standardize safe staffing ratios and protect both nurses and patients. HR 2530 was introduced by Representative Jan Schakowsky in 2023. The bill proposes establishing mandatory nurse-to-patient ratios in hospitals across the United States. Its purpose is to reduce preventable harm, improve transparency in staffing practices, and support nurses with realistic workloads. As of now, the bill is under review in the House Committee of Energy and Commerce, where it remains without action. To visualize the staffing recommendation, this slide includes a graphic from the National Nurses United outlining safe nurse-to-patient ratio by unit. It proposes a 1:2 ratio in ICUs and a 1:4 ratio in step-down units and telemetry units, for example. One of the bill's strengths is that it focuses on public accountability. Hospitals would be required to report staffing data and outcomes. This is supported by the American Nurses Association, which has long advocated for enforceable staffing models. The ANA emphasizes that safe staffing is essential to protecting patient outcomes and reducing preventable adverse events such as medication errors, infections, and readmissions. The case for mandated staffing ratios is supported by strong quantitative evidence. In an observational study of New York hospitals, Lassiter et al. Found that hospitals with higher nurse workloads had significantly worse outcomes. For every additional patient added to a nurse's assignment, the likelihood of patient death increased. Their projections showed that implementing a 4:1 nurse-to-patient ratio across hospitals could save over 4,300 lives and reduce healthcare costs by more than $700 million within 2 years. This article emphasizes measurable life-saving impacts that adequate staffing and nurse-to-patient ratios could have. The study also revealed that hospitals with better staffing and shorter patient stays had fewer readmissions, both of which drive down costs and improve hospital performance under value-based purchasing models. These are the types of data that should drive policy and prove safe staffing is a clinically sound and fiscally responsible investment. Let's take a look beyond the data. There's an ethical need to act. Provision 6 of the ANA Code of Ethics calls on nurses to advocate for environments that allow safe and compassionate care. When staffing is inadequate, we are placed in positions where we cannot meet the standards we are trained to uphold. This creates moral distress and a feeling of being responsible for harm that is preventable but out of our control. Nurses are not only leaving the bedside because of burnout, but because they can no longer practice in a way that aligns with their values. From a Christian perspective, this is a matter of justice and stewardship. Proverb 31, verses 8 through 9 reminds us, "Speak up for those who cannot speak for themselves. Defend the rights of the poor and needy." As nurses, we are called to be advocates, not just at the bedside, but in policy, where we have the ability to directly affect systemic changes. The social consequences of unsafe staffing extend far beyond the hospital walls. When nurses' workloads are too high, care often becomes rushed. Patients and their families feel that they do not receive the detailed care they need. Patients, especially those from vulnerable populations, may experience errors, missed care, and poor communication. This unfairly affects individuals with chronic illnesses, disabilities, language barriers, those who are uninsured, and the critically ill, patients who cannot advocate for themselves. These patients often don't have the resources or ability to navigate the system after a negative experience. When they view care as rushed or unsafe, it weakens their trust in the healthcare system. Over time, this creates a ripple effect. Patients delay seeking the vital care that they need, conditions worsen, and their outcomes deteriorate. This is more than an operational issue. It's a matter of health equity. Ensuring safe staffing isn't just about nurse workload. It's about ensuring that every patient receives high quality, dignified care. Opponents of HR 2530 argue that mandating staffing ratios would be too expensive for hospitals. The reality is that poor staffing is actually costing the system. Hospitals with high nursing workloads face longer lengths of stay, higher readmission rates, and increased penalties under CMS's value-based purchasing model. These penalties are directly tied to patient safety metrics, which are driven by nurse-sensitive indicators like falls, infections, and pressure injuries. A 2023 study by Pang et al. Found that inadequate staffing increases burnout and nurse turnover. This creates a costly cycle. Hospitals spend significant resources recruiting, onboarding, and training new staff, only to lose them when conditions remain unchanged. Investing in safe staffing isn't just ethically sound, it's fiscally smart. It stabilizes the workforce, reduces costly complications, and improves hospital performance under reimbursement models. It is important to acknowledge the concerns raised by hospital administrators. You're operating under budget constraints, workforce shortages, and rising demands. Some worry that federal staffing mandates might reduce their flexibility or create unintended burdens. However, doing nothing is a costly choice. As things stand, staffing constraints are harming patients and driving nurses away. The National Academy of Medicine's 2025 report, titled "Healthy Providers, Healthy Patients," emphasizes that workforce well-being must be a national priority. HR 2530 should be seen not as a constraint, but as an agent for creating these needed changes. It creates a structure to improve conditions while allowing for flexible staff-patient ratio implementation at the unit level and based on those unit needs. Opponents and proponents can find common ground in the goal of delivering safe, high-quality care through sustainable staffing models. I have several recommendations that can make the legislation effective and realistic. First, adopt a tiered acuity-based staffing model. Not all units have the same needs. A med-surg floor and an IC require very different resources. Ratios must be adjusted based on patient acuity and nurse competency. Second, strengthen the nursing workforce pipeline. This means investing in nursing education, expanding loan forgiveness programs, incentivizing clinical preceptors who train future nurses. These strategies will help address staffing mandates without over-reliance and overuse of travel nurses and agencies. Third, build in accountability. Hospitals should face meaningful penalties for failing to comply, and whistleblower protections must be in place to empower nurses to report unsafe conditions. Finally, nurses have to have a seat at the table, so to speak. Staffing plans should be developed with input from nurses, nurse leaders, not dictated from the top down. This ensures that policies reflect real clinical conditions and protect both the patient's safety and the staff well-being. The Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act represents an urgent and necessary step forward. The evidence is clear. Unsafe staffing harms patients, drives nurses out of the profession, and creates financial losses for hospitals. We also have a professional and moral obligation to act. This legislation reflects the values of evidence-based practice, ethical responsibility, and compassionate advocacy. If passed, HR 2530 can begin to shift our healthcare system toward one that prioritizes safety, sustainability, and equity. I urge policymakers, hospital leaders, and fellow nurses to support this effort and ensure that staffing policies reflect the care our patients deserve and the conditions that our nurses need to thrive. Thank you.